Welcome to the Victory Education Lounge. I'm your host, Maurice, and today we're diving into part 84 of our series exploring the fascinating hypothesis that Alzheimer's disease might be type 3 diabetes. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this crucial information. Alzheimer's disease and diabetes. Two conditions that might seem unrelated at first glance, but emerging research suggests a compelling connection. The type 3 diabetes hypothesis proposes that Alzheimer's disease could be a form of diabetes that specifically affects the brain. Today, we'll explore this concept, discuss management strategies, and look at prevention methods that could potentially reduce the risk of both conditions. This concept, as intriguing as it is more than just an intellectual curiosity. It holds the potential to revolutionize our understanding of Alzheimer's, a disease that affects millions worldwide, and may offer new avenues for prevention and treatment. Let's set the stage, shall we? Alzheimer's disease, a progressive brain disorder that impairs memory, thinking skills, and the ability to carry out simple tasks, is one of the most common forms of dementia in older adults. It's a debilitating condition that not only affects the individuals diagnosed, but also their families and caregivers. On the other side of the spectrum, we have diabetes, a condition that affects how your body turns food into energy. Most of us are familiar with type 1 and type 2 diabetes, but what about type 3? This is where our journey begins. The type 3 diabetes hypothesis is a relatively new concept in the medical field. It suggests that Alzheimer's disease could be a form of diabetes that specifically targets the brain. If you're wondering how these two seemingly disparate conditions could be related, the answer lies in a familiar culprit: insulin resistance. In type 2 diabetes, cells in the body become resistant to insulin, a hormone that helps regulate blood sugar levels. When this happens, sugar builds up in the blood instead of being used for energy. Now, imagine a similar scenario, but this time, it's not the body, but the brain that's resisting insulin. The brain cells become less responsive to insulin, leading to less energy for the brain to function properly, possibly resulting in cognitive decline and ultimately, Alzheimer's disease. This hypothesis, if proven, could potentially link two of the most common health issues in our society: diabetes and Alzheimer's. It could be a game changer, paving the way for new treatment strategies and preventive measures. The link between Alzheimer's and diabetes centers around insulin resistance, a concept we're about to delve deeper into. Insulin resistance is a key player in both type 2 diabetes and our current discussion about Alzheimer's disease. But what exactly is insulin resistance? Well, imagine insulin as a key. Now, your body's cells are like rooms with locked doors. Insulin's job is to unlock these doors, allowing glucose from the bloodstream to enter the cells and provide them with the energy they need to function. However, in insulin resistance, these keys, or insulin molecules, have a hard time unlocking the doors or receptors on the cells. The result? The cells don't get the glucose they need, and this excess glucose builds up in the bloodstream, leading to high blood sugar levels, a hallmark of type 2 diabetes. Now let's bring this understanding to the realm of the brain. The brain, like all other organs, requires energy to function, and just like the rest of the body, it relies on insulin to provide glucose to its cells. But if these brain cells become insulin resistant, they may not get the necessary glucose, potentially affecting cognitive function and leading to conditions like Alzheimer's disease. This is where the type 3 diabetes hypothesis comes into play. It suggests that Alzheimer's disease might be a form of diabetes that specifically affects the brain. An intriguing idea, isn't it? And while this hypothesis is still under investigation, it has the potential to revolutionize our understanding and treatment of Alzheimer's disease. In essence, insulin resistance is a condition where cells, whether in the body or the brain, struggle to respond to insulin, leading to high blood sugar levels and potentially cognitive decline. It's a central concept in the type 3 diabetes hypothesis, and a key factor linking Alzheimer's disease and diabetes. With this understanding of insulin resistance, we can now discuss strategies to manage and possibly prevent these conditions. Let's consider some solutions, management strategies, and prevention methods that can benefit both diabetes and Alzheimer's disease. First off, dietary changes. It's all about adopting a low-glycemic, anti-inflammatory diet. Why? This kind of diet may improve insulin sensitivity and provide brain protective nutrients, but it's not all rosy. It requires significant lifestyle changes and meal planning. Next up, Regular exercise. Whether it's aerobic or resistance training, consistent physical activity can improve insulin sensitivity and promote brain health. The challenge? It requires a consistent effort and time commitment. Moving on to cognitive stimulation. Engaging in mentally stimulating activities may help maintain cognitive function and create a cognitive reserve. But remember, the benefits may vary and it's not a guaranteed prevention method. Now, let's talk about sleep optimization. Ensuring you get adequate, quality sleep supports brain health and helps regulate blood sugar. But it may be challenging for those with sleep disorders or busy schedules. Last for today, stress management. Practicing relaxation techniques and reducing stress can improve overall health and potentially reduce Alzheimer's risk. But it may require learning new skills or making lifestyle changes. These strategies require a degree of commitment and lifestyle change, but the potential benefits to brain health and insulin sensitivity are significant. In our next segment, we'll examine more strategies, including social engagement, blood sugar monitoring, cardiovascular health, nutritional supplements, and regular health screenings. Remember, while these strategies can be beneficial, they are not guaranteed prevention methods for Alzheimer's or diabetes. Always consult with your healthcare provider before making any significant changes to your health routine. Stay tuned for the next part of our series where we continue our exploration of the type 3 diabetes hypothesis. As always, stay curious, stay informed, and stay healthy. Until next time. Continuing with our list of strategies, let's explore social engagement, blood sugar monitoring, cardiovascular health, nutritional supplements, and regular health screenings. Our sixth strategy, social engagement, is all about maintaining strong social connections. This can provide cognitive benefits and emotional support. However, it could be challenging for introverted individuals or those with limited mobility. Next, we have blood sugar monitoring, which involves regularly checking and managing blood glucose levels. This helps maintain optimal blood sugar levels, potentially benefiting brain health. The downside? This requires ongoing effort and possibly medical supervision. Our eighth strategy focuses on cardiovascular health. Managing blood pressure and cholesterol levels supports both brain and heart health. This may require medication and lifestyle changes. Nutritional supplements are our ninth strategy. Taking targeted supplements under medical supervision may help address nutritional deficiencies linked to cognitive decline. But remember, supplements are not a substitute for a healthy diet, and there's a potential for interactions with medications. Finally, we have regular health screenings. Scheduling routine checkups and cognitive assessments allows for early detection and intervention. This can be time-consuming and potentially anxiety-inducing, but the benefits can outweigh the drawbacks. It's important to remember that these strategies are not foolproof methods to prevent Alzheimer's or diabetes. They serve as tools to manage and potentially reduce the risk of developing these conditions. Also, it's crucial to understand that everyone is unique. What works for one person might not work for another. Therefore, it's always best to consult with healthcare professionals before making significant changes to your lifestyle or diet. These strategies, while requiring ongoing effort and possibly medical supervision, can significantly contribute to maintaining optimal health. Now let's look at some examples to illustrate these strategies. Consider Sarah, a 65-year-old woman who switched to a Mediterranean diet full of vegetables, lean proteins, and healthy fats. She found the change challenging at first, but she noticed a significant improvement in her energy levels and cognitive functions after a few months. Then there's John, a 50-year-old man with a family history of Alzheimer's and diabetes. He started regular aerobic and resistance training and found it challenging to stick with the routine initially. However, after a few weeks he started enjoying his workouts and even noticed an improvement in his mood and alertness. Take Emily, a 70-year-old woman who started engaging in mentally stimulating activities like puzzles, reading, and learning a new language. Despite her initial skepticism, she found these activities enjoyable and noticed that her memory seemed sharper. Consider also David, a middle-aged man who made a conscious effort to improve his sleep quality. He started going to bed and waking up at the same time every day, even on weekends. It took some time to adjust, but he noticed an improvement in his mood, energy levels, and cognitive function. Finally, let's look at Laura, a woman in her late 50s who started practicing stress management techniques like yoga and meditation. She found it difficult to find time for these activities in her busy schedule, but she persevered and noticed a significant reduction in her anxiety levels and an improvement in her overall well-being. These examples underscore that implementing these strategies can be challenging, but can also lead to significant health benefits. It's important to remember that everyone is unique, and what works for one person may not work for another. Always consult with a healthcare professional before making significant changes to your lifestyle or regimen. Remember, every step you take towards managing your health can make a significant difference. Before we conclude, I want to emphasize that the information in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Your healthcare team knows your individual situation best and can provide personalized advice. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Stay tuned for our next episode as we continue to explore this fascinating connection between Alzheimer's disease and diabetes. Until next time, this is Maurice wishing you health and vitality.